Meghalaya reported 2 COVID-related deaths on late Saturday and early Sunday at the Northeastern Indira Gandhi Regional Institute of Health and Medical Sciences, Mawdyangdyang. The deceased have been identified as Bantailang Singhai 40 from Latcharai village in Riboy district and 48-year-old Nandeshwar Deori, a BSF Jawan. Singhai was a senior engineer working with the Geological Survey of India at Kolkata. Briefing reporters here on Sunday, Meghalaya Director of Health Services Dr. Aman War informed in detail about the deaths of these 2 patients following a report from the Northeastern Indira Gandhi Regional Institute of Health and Medical Sciences. According to Dr. War, the mortal remains of Singhai were laid to rest at Latcharai village, while those of the BSF Jawan were taken to the crematorium at Jalupara on Sunday. With these 2 new COVID deaths, Meghalaya has now recorded 4 deaths due to the virus.
The 2 persons who had passed away at Negrams, who were admitted at Negrams, and as per the records, as per the report from Negrams, one is Shri Bantailang R. Singhai. He is from Lalcharai, Riboy district. And another one is Nandeshwar Deori. He is from BSF. I will read out the summary of Bantailang R. Singhai. The patient was admitted at Negrams on 5th July 2020 with complaints of pain in the right upper quadrant of the abdomen. He had just returned from Kolkata on that day and was in a quarantine facility prior to transfer to Negrams. He was transferred to Negrams on 5th of July 2020 itself when he had complained of pain, abdomen inside the quarantine center. On evaluation here in Negrams, he was diagnosed as a case of acute calculus cholecystitis. His sample was also taken for RT-PCR, which was positive for COVID-19. He was shifted to the COVID isolation ward and was conservatively managed. During his course of stay, he developed diarrhea and acute kidney injury and was transferred to the COVID ICU for further management. His 2 samples on 16th and 17th July were negative. Prior to him being taken to ICU, 16th and 17th July, he was all right. His samples also have tested negative. He, however, developed sudden onset respiratory failure on the 18th of July 2020. He was initially managed on non-invasive ventilation, but did not improve and was subsequently intubated. His respiratory failure worsened and he developed respiratory and cardiac arrest on 18 July 2020. CPR was given accordingly, but he could not be revived and was declared dead at 23:56 hours, 11:56 p.m. The immediate cause of death is type 1 respiratory failure with acute kidney injury. The antecedent cause is COVID-19, and the contributing causes is acute calculus cholecystitis. Summary of Nandeshwar Deori. He is a contact at Umpling BSF campus on 1st of July 2020, and as a high-risk case, he was put under quarantine, and when they had done the RT-PCR, it turned out to be positive. He was placed in the composite hospital, and on 12th of July 2020, he was referred to civil hospital because of certain complaints which points out to complications of COVID-19. And from civil hospital, they had referred to Negrims on 13th of July 2020. This was the particular patient which I had mentioned, who was very serious and he was critical. The patient had a history of contact with a laboratory confirmed case of COVID-19. He developed symptoms suggestive of COVID-19 and was tested on 4th of July, where it came out as positive. He was also a known case of type 2 diabetes. He was initially managed at BSF Composite Hospital, Umpeling, but was referred to civil hospital in view of worsening breathlessness and persistent cough. He was then transferred to Negrims on 13th July 2020 in view of need for ICU care due to worsening symptoms. On arrival in Negrims, he was managed in the COVID ICU. He was in acute respiratory distress syndrome with severe sepsis and multi-organ failure. He did not improve with treatment. He developed respiratory and cardiac failure, which did not improve with resuscitative efforts and expired on 19th July 2020 at 2 a.m. The immediate cause of death is type 1 respiratory failure with multi-organ dysfunction syndrome. Antecedent cause is COVID-19 and acute respiratory distress syndrome. Contributing causes is type 2 diabetes mellitus. The name of this patient is Nandeshwar Duri. He is a Jawan of the BSF. Yai ni nomor bidan uni mau hapo oksang. Mo ti ki klampat pelai binlet quarantine corona care center lani ba inlet shayeng ru ban quarantine. Nomor ba kidang don complication nau ni umau pada. Nomor idon complication nomor tangsu te yo saya gani ka COVID-19 te kai ka jing batai na po Negrims kilong ba ka injury ka ba yo gani kidney injury ka bagi ai maki kadai na ka effect jong new virus hakamet ka jungi ta kadau ki bat sai yang tu but haka kanyu na de test long negative ta maki khampat declare di long recover ki kham declare na bi don kini ki we khat phra tarik pare develop concern kini ki symptom ka one shot kan ko diarrhea deb diarrhea bidon severe dehydration kira ano spo ICU te yo respiratory failure hang tu kawai na ki main you know COVID-19 ketika side ka effect no COVID-19 respiratory failure dena takada klat ni lakilale ka kilabu I po ventilator tama kihamale issue ini dan rumah safus na me ini di return ni di bawah po Kolkata hakasan sapo Safu Fra. Ni orang Safu Riu ni tu kasi di Safu Fra pelayo. Kelai ke dia obat. Tapi umdai ni pi. Kun utu bom pediang umdai bom pediang sekolah kata. Te ki ide baterai for Meghalaya situ. Umdai ni tu one bed. GSI ha, di baterai for GSI. Kani kamet ke jong ni BSF kin pendap hang ni apa jelo parah la de penbet kham sibet tarai mentah ka jong ini I lead bantai lang singai ru ar singai kin pendap mentah si tiga tu ka met kin angkit mentah kata puji kelakit kin ra sepo lal cerai tika snong ru kala information ka balang ru kala ong bagin dayu tinggi aingu I ka snong namar balai dan gano ko jing puntut kam dan gano ko jing ting kila ai ta function kila ada pen kre ka thli ge berfat ka jakatep tiket sulit ra tika na liang ki bahi yang ikan ra ya kamet ngila ai ki PPE ya ki precaution ge berfat dan ni banting tikin pendam hi mentasi